So when someone is faced with a new diagnosis of ankylosing spondylitis, much like a new diagnosis of any chronic disease, it requires a process to understand, to cope with the loss of their healthy self, and then make a plan for how to make the best of the situation. I could not emphasize any more the need for people to educate themselves about the disease, the need for people to understand the therapeutic options, understand the medication options, but also the non-pharmacological options. They need to have a team around them, their doctor, their physical therapist, their family members. They all should be coming together and supporting this effort because it's a big effort. The treatment of ankylosing spondylitis is a chronic treatment. We don't have a cure. We can't fix it overnight. It's a long-term commitment. And a large portion of that is medication, but a very large portion of it is lifestyle changes. An excellent exercise regimen, possibly done with a physical therapist or a trainer, to go over mobility exercises, core strengthening, position, posture, things that allow the best possible physical function for the individual, and then medications that lower the inflammation. And because as the inflammation gets lowered, the risk for the chronic consequences of inflammation is lower. There's less damage to the spine. The earlier we intervene, the earlier we start lowering the inflammation, maintaining mobility, strengthening the muscles, the more likely that the outcomes are going to be excellent. The majority of people that are diagnosed with ankylosing spondylitis have normal lives. And I think that that is the goal. And that is the purpose of going through this exercise of working with a physician, taking the medications, doing the physical therapy, that the goal is to maintain normal lives.